join in these classes for sure. Okay, it's very, very important. You have to read SGTM-IG, then come up with the questions, and then we can discuss. Without this SGTM-IG knowledge, in the going forward, nothing you are going to do. Okay, so please be serious, and then if not, please start immediately and then come up with the questions we can discuss. Okay, so if no questions, I think we can discuss today another domain like concomitant medication. I hope everyone can see my screen, right?
Yes, sir.
Yeah, so far we have multiple times discussed what is the concomitant medication. Yesterday also we discussed. Okay, so can anyone tell what is the concomitant medication? What is concomitant medication?
So during the study, the subject has taken another prescription rather than the study treatments.
Other than the
Right. Okay. So yeah, during the clinical trial, subject took any other medication than protocol specified drug, then we can consider as a concomitant medication. It might be therapy, it might be the treatment, it might be the drug, whatever it may be. Okay, so those we can say the concomitant medication. So the concomitant medication is falls under which SGTM class? What is the classification of this? Interventions. Okay, interventions is nothing but something given to the subject, most into the drug related domains. What all are the domains we have in the concomitant, interventions? Did anyone remember this SDK domain classification? Under intervention, what kind of domains? At least can anyone name it 3-4 domains?
EX, EC,
Exposure,
Yeah.
exposure as collect.
and PR.
There's a concomitant medication, and then substance use also we can take it, right? Substances use domain. Okay. Anyway, today we are going to discuss about the concomitant medication. So here, not only the concomitant medication, we are going to map the prior medication. Prior medication is nothing but before enrolling to the clinical trial subject, is there any previous medical history? Okay, I mean previous medical history means previous history of the took any drug. Okay, so the prior medications, we can say the prior medication. For example, so subject is enrolled into the clinical trial. So when the screening visit, they will ask that did you take any prior medication before this? Okay. So then some people, due to some various reasons, like some people will have the migraine, they might use to the migrainal tablet or any other medication. Some people will have diabetic, they might take the insulin related stuff, and then some people will have this thyroid, they can take the thyroid related medication, whatever it may be. So is there any prior medication? They'll ask in the screening visit. Okay, if yes, then need to provide the prior medication. So what kind of treatment is this, what kind of drug that is, and then when it was started, when it was ended, what kind of dose, everything will be captured. Okay, along with the concomitant medication, prior medication also we can map into the CM domain. Okay, so when it comes to the structure of the concomitant medication, okay, one record per recorded intervention occurrence or the constant dose interval per subject. Okay, so here if you can see the one record per recorded intervention occurrence. Okay, how many times he or she took the drug. Okay, and then constant dosing intervals per subject. For example, subject suffering with the fever, doctor prescribed that take this medication, like okay, this take the Dolo or every 6 hours. Subject might take the 3 times a day. It means the same medication he took the 3 times. Okay, there will be 3 records for that particular subject. So it means based on the treatment, based on the constant dosing. Okay, how many times he or she took the medication, those many records comes to the concomitant medication here. Okay, so as I said, when it comes to the variables, there are few variables identifiers will be remain same for the across the SDTM. Okay, so those kind of variables, the study ID, domain, use subject ID. So these all are the variables very common into the all domains. These are the identifier variables and then required variables for each and every domain. So again, the CM sequence. So when it comes to the sequence, if there are a possibility to more than one record per subject in one particular domain, we are going to create the sequence by subject wise. For example, if we have the one subject 10 records, we are going to create the sequential number 1, 2, 3, 4, 5 until 10. Okay. I think yesterday I have given this task, right, for to work on this. The sequence, create a sequence number. I have given one task for the adverse event. Okay, so I asked everyone keep ready your code. Did everyone complete it? No one tried at least. I mean, if it's wrong or anything, at least you tried or not. If yes, please provide your code here. No one did this task. Yes or no? No one did this task or no? This is a very simple task in the SAS. I hope everyone completed the SAS topics already and the SAS classes will done, at least most of the people. To have completed the SAS task, then they are unable to do this code means there is a you people needs to practice more. There is a lot of things to you should explore. There is a lot of things you should practice. There is a lot of things you need to understand. Why? Because this is a very, very simple task. If you are unable to do this task means if going forward when we start programming activity, that might be really difficult for you. No one knows this code, piece of code ever రాయలేదా? No one tried? అందరికి టాస్క్ అర్థమైంది కదా? yesterday what I given? I think yesterday said that yes, everyone understood. మీరు సాస్ నేర్చుకునేటప్పుడు మీకేం టాస్క్లు ఇవ్వలేదా? ఓన్లీ సాస్ చెప్పారు అంతేనా? ఇచ్చారా లేదా? హలో, చేశారా లేదా మరి మీరు? So then this is also one task, right? Then why you are not doing? At least you should try, right? I just given a simple task. It's not a big deal. Hardly it will take less than 1 minute to write a code. Less than 1 minute. Okay, so if you tried and you are not getting the logic, let me know. If you haven't tried, go and try it and then come up with the answer, okay? Anyway, so we'll continue this variable things. Okay, the CM GRP ID, group ID. So as I said, we can group it some number of like a group of records to the one thing. Okay, so based on the particular criteria, so this we can create a group ID. Again, it will not useful for each and every study. If the trial requires, we can utilize. Okay. SPID also, CM SPID, sponsor specific ID. As I said, if the concomitant medication, if there are any record sponsor want to highlight in the particular name or number, whatever it may be, then we can create this SPID. Then the CMTRT. CMTRT is nothing but the treatment name. So the reported name of the drug or medication or the therapy. So this is the CMTRT is the important variable and topic variable of the your concomitant medication domain. So CMTRT is the topic variable. Okay. So what kind of information we can map it to the CMTRT? Can anyone? ఏ ఇన్ఫర్మేషన్ మ్యాప్ చేస్తాం ఇక్కడ? In concomitant medication, what kind of information we are going to map it? ఏమైంది? ఇప్పుడే చెప్పినా కదా, ఏ ఇన్ఫర్మేషన్ మ్యాప్ చేస్తాం concomitant medication లో? Hello, what kind of information we are going to map to the concomitant medication?
Name of the drug.
Right, that's correct. So here the simple right treatment name of the drug we can mention. For example, subject to that for example paracetamol, the name of drug is the paracetamol, right? So that we are going to put it here. So CM modify is also another standard name of your the particular name of the treatment. So this is the synonym qualifier. So this we are going to map it here. Okay, so again the CMD code is comes from the these two comes from the CM modify, and then CMD code comes from the WHO drug dictionary, WHO World Health Organization WHO drug dictionary. So if you can see, this is the WHO drug dictionary will come. Okay, again what I said in the yesterday also in adverse event, we will use the meta dictionary, those coding terms. Okay, even it's a WHO drug dictionary or even the meta dictionary, what all are the coding variables comes from the direct data management. They are going to map in your raw data set. We need to map from the raw data set to SDTM. It's a one-to-one mapping. Okay, so the category, so CM cat and SCATs. Okay, this is a medication category. For example, if you can say this anti-cancer medication, general med, or the prior medication, this is the category. Subcategory, if you want to categorize furthermore, then the chemotherapy, hormonal therapy, so alternative therapy, these are the some of the examples for the category and subcategory. Okay, so the presp and occur. So yesterday also we said this CM presp and occur. For example, as I said, the CM presp is nothing but the pre-specified. Okay, in your trial they want to see the specific medication should the particular medication subject to or not. Okay, they have given in the CRF some list of 10 medications. If the subject took any one of the medication, they have to tick it. Okay, so those 10 medication, we can say that we can create the 10 record each and every subject, and then CM presp should be Y. Means those are the 10 records, the pre-specified 10 records is a Y. So for example, if we have the 10 records in the CRF, is that the really subject to those 10 records? Sometimes it's, sometimes not, sometimes might be taken two medication, sometimes may taken one medication, sometimes may taken 10 medication. But however, what kind of medication you took from out of those 10 drugs, okay, the CM presp will say that the 10 to 10 records, it's a YY, it's a pre-specified medication. But when we check that what kind of medication took until those, out of those 10 medication, then we can check the CM occur. So out of 10, he took that how many medication, the occur should be Y. For example, subject 10 medication taken, those 10 records will have the occur Y. For example, out of 10 subject took only one medication, then those one medication should have the one record Y. Okay, CM presp and occur. Okay, pre-specified and occurrence. Again the status. Okay, whenever the pre-specified is that, okay, if there is no record there is no medication taken, then we can create the CM start not done. Okay, so out of those medication, subject did not take any medication, then we can say that the CM start not done. Why he has not taken, we can mention the CM reason for the medication not collected. Okay, so these are the 4 variables are interlinked variable. It is a pre-specified, and then whether it's subject to or not the occurrence, and then if he is not taken, then not done, then why it's not done, that is the reason. Okay, so the CM indication, why this subject was take this particular concomitant medication. So it might be the adverse event, right? So we can say if the subject took the nausea due to this medication, nausea, hypertension, whatever the adverse event name, you can put it the indication. So the CM class and the class code. Okay, based on the WHO drug dictionary, each and every medication will have the class code. So those also will comes from the WHO drug dictionary. This we can put it into the data sets, and we need to map the one-to-one mapping. CM dose. Okay, dose is nothing but subject to the medication. Obviously, what kind of dose it is? It is, if it's an injection, it's a 1 ml, 0.1 ml, 0.01 ml. If it's a tablet, 100 mg, 200 mg, 250 mg, 1000 mg, whatever it may be. Okay, so this is the CM dose and the CM dose text. Okay, so here the important things you need to understand. What is the dose? What is dose text? For example, we'll have the 200 is a mg. Will get CM dose. For example, sometimes, okay, dose text, for example, 500 mg will comes into the dose. But the information captured at 200 to 250 mg. Then there is a range. Then we cannot put into the dose. Why? Because we cannot put the range. In that case, we will populate the dose text. So if you can see the values 200 to 400, 15 to 20, okay. So then we cannot populate when the dose, then we can use the dose text, okay. So then sometimes what happen, if you can see some of the medication will comes under patches, okay. If you can see recently the painkillers will comes under like patches. So wherever you are getting pain, we can stick that patch, okay, kind of band-aid, okay. So then there also we cannot put the medication dose, right? We can use the patch and whatever it may be. So all those we can use the dose text. Again, CM dose units, okay. If the dose is 100, 200, what is that? Is it mg or ml or nanograms, micrograms, okay. So whatever the dose units, that could be mentioned it here, okay. So the dose frequency, dose form, CM, DOS, FRM, dose form. What is the dose form, okay? Is this tablet or is this lotion, is this patch or is this whatever it may be, injection? So that dose form, what is the dose form? We can put it here, okay. And then dose frequency, dosing frequency per interval, okay. So how frequently he took, for example, if you go and go and contact with the doctor for any reason. So if the doctor diagnoses any particular diagnosis, then he should write a prescription for the particular drug, treatment. So they'll write, okay, like daily once, daily twice, weekly twice, or weekly once, okay, bi-weekly. And then these are all the frequencies. How many times you should take the drug, that is the frequency. For example, sometimes, okay, you need to take the daily one. Sometimes you need to take daily thrice, okay, morning breakfast, before breakfast, and then after lunch and after dinner. So if you can see in the prescription, they'll write like 0, 0, 0, 3 times a day, 0, 0, 2 times a day. Okay, some kind of, for example, vitamin D, you should take the weekly ones. Okay, which is maintenance dose, you should take the monthly ones. So those are the frequencies, how he should or she should take the particular medication, the frequency. And then CM dose TOT, the total daily dose. For example, if you can subject the take multiple times in a day, then what is the total dose? Okay, morning 250, afternoon 250, evening 250 mg. So then what is the total dose? It's a 750 mg. Okay. So again, this will not collect each and every study, it depends on the study. And then CM dose regimen, okay, so intended dose regimen. So intended dose regimen means, for example, sometimes the 2 weeks on, 2 weeks off, how the dose regimen was taken. For example, some kind of medication, we continuously take the 2 weeks, then we will give it the gap 2 weeks or 1 week, 1 month. So then we'll start. So what is the dose regimen? Okay, so the text description of the intended schedule for the regimen for the intervention. Example, 2 weeks on, 2 weeks off. So these will come the dose regimen. And the route of administration, how the subject took the drug. For example, if it's a tablet, we can take the orally. Okay. For example, if it's an injection, intravenous, okay, how the subject took that particular medication. Okay, so the route of administration. Okay, so these are the route. And then concomitant medication start date, CMST DTC. Okay, so and then concomitant medication end date, CMENDTC, when the concomitant medication start and when it ends. And then CMSTDY corresponding study day of the concomitant medication start date is. And then concomitant medication and the corresponding end day with respect to the CMENDTC. So these all are, as I said, each and every domain will have the date variables corresponding study day variables. So if you have the CMSTDT, CMSTDY, if you have the CMENDTC, CMENDY. So this you already know. We can compare with the RFSTDTC, and then if your assessment date is on or after, then your assessment date minus RFSTDTC plus 1. If its assessment date is less than your RFSTDTC, then assessment date minus your RFSTDTC. That's the principle, the derivation of your study day calculations. CMDUR, okay, duration of medication, how much duration, how many days or months she has taken the medication, what is the duration. Okay, then again the TPT variable CMSTRF. Okay, so the CMSTRF, there is nothing but the start related to the reference period. Okay? When the treatment is started, CMSTRF, okay, reference. And the end reference also same, when it was started reference, when it was ended reference, okay. So again the values will come same, prior, ongoing, continuing, okay. Start and end references will be similar, okay, with respect to the particular point. Then the CMSTRTPT. So what is the particular reference we are giving, that particular reference will comes here, and then particular reference date comes here. Okay. So for example, first dose of drug administration we say, so that the text comes here, and then CMSTTPT, that particular first dose of drug administration day will come here. Okay. Again the end date also, end TPT also. What is the reference, you can give it here, and then that reference date it here. Okay. So you can give that particular time part variable. We can take the one of the class for the all kind of time part variables in with the example, so that you can easily understand. Okay. So that's it for your concomitant medication variable. I am saying that, okay, the variable naming convention would be more or less similar to the all your based on the class. Only special purpose domains will have the difference, okay. But when it comes to the interventions, event findings, your variable naming convention should be same. So now what we have, collect EXEC, and then substance use, your variable naming convention would be similar, more or less similar. Only the CM, instead of CM you will get that EX, instead of CM you will get that EC, instead of CM you will get that SU. It depends, okay. So if you know the variable naming convention, more or less it should be similar. Okay. So please, I'm once again saying that, okay, please go and read your each and every particular domain variable names, and then what kind of data is going to map to the particular variables, and at the end the assumption for your particular domain. So once you read the variables, they will give the real-time examples here, how the data is going to map. So this is assumptions is very, very important. You go and read it and come up with a question if you're not understanding. Okay. So for example, if you can see this here, okay, the CM domain, okay. So the domain name is CM, and then your subject ID, and then sequence, okay, 1, 2, 3, 4, 5, 6, okay. The first subject took that 6 records, okay. We have 6 times he took the aspirin. What is the dose? 100 mg, okay. So units is the mg. CM dose frequency, okay, he took that daily once, okay. So when it was started and when it was ended, okay. So for example, yeah, if you can see here, there is a different for the second subject. So here you can see the Q2 H24, okay, daily once, okay, or the after 24 hours he took, okay, and then BID is daily twice. Okay, so the PRN is as and when needed. Okay, if you go and check in any prescription, sometimes some painkiller doctor run SOS. Normally doctors will write SOS. SOS means as and when needed. Okay, so when the subject get the pain, then only he took. Otherwise, it's not really required, the painkillers. So something like that, the frequency we can update here. Okay. So then the category and subcategories, if you can see this anti-convulsant, okay, I'm not sure what is this, okay, but the treatment and then your particular categories. So there are different examples. If you can see, this is the CMTRT, Prescribed by, these are the 3 pre-specified medications. For that's why it should be the CM prescribed should be Y. So if the subject took this medication, Zoloft, that's why it's N, otherwise it should be no. So here you will have the missing prescribed Y and then result missing, that's why it is not done. Okay. So why it's not done, the reason should become didn't ask due to the interruption. Okay, that's the reason for the not collected the occurrence. Okay, so if you can see these examples, the same example what we have discussed, they will explain it here. Okay, so yeah, so that's it for this